Good afternoon, everyone, and welcome to our Education Hour. We're pleased to have you join us for Strengthening Hepatitis B Prevention, Advocacy, and Awareness. My name is Catherine Flores. I'm the Executive Director for the California Immunization Coalition, and I'll be moderating this call. Next slide. The California Immunization Coalition hosts education hours and emerging issues conversation programs throughout the year on immunization-related topics to help our colleagues stay up to date on important news and information. Next. Today's program will be a clinical overview and an update of hepatitis B and immunization guidance, a review of the SF Hep B Free project and their efforts on a local, state, and national level to increase awareness about hepatitis B, in particular about awareness among Asian and Pacific Islander adults. We want to discuss the importance of promoting routine hepatitis B testing and vaccination, and want to highlight the importance of ensuring access to treatment for chronically infected individuals. Next. Following today's program, a recording will be available on our CSC YouTube channel website. If you're not familiar with our YouTube website, we encourage you to Google that one after this call, and you can find a lot of programs that we've done in the past, and our previous Ed Hours and our emerging issues conversations. Prior to that, our COVID conversations. So it's a great spot to go back and review some information or share with your colleagues if they weren't able to make it today. So be sure to describe, and that'll help amplify our voice. Excuse me. A reminder, next slide. A reminder that all participant lines are muted. If you need technical assistance, you can use the chat section, and Cameron can help you with that. Also see the chat box for instructions that can help troubleshoot any technical issues. But for questions, please use the Q&A box, and I'll be monitoring that along with Cameron, our speakers, if they have time, and then we have some subject matter experts to assist us. So now it's my pleasure to introduce our wonderful speakers, and then I'll hand it over to Dr. Liu to start. Katerina Liu, MD, MPH, is a public health medical officer with the immunization branch at the California Department of Public Health. She received her medical degree from the University of California, San Francisco School of Medicine, and completed her residency in internal medicine and preventative medicine at Kaiser Permanente, San Francisco, and UCSF. Next slide. The motivation for this webinar is thanks to our partnership with SF Hep B Coalition, Hep B Free Coalition, and their Executive Director, Richard So. As the Executive Director of SF Hep B Free, Richard is dedicated to their mission of fighting hepatitis B infection and the liver cancer it causes. His goal is to make the San Francisco Bay Area the first hepatitis B free area in the nation, which is a remarkable and amazing mission. He's worked in healthcare for over a decade with focus in public health, and Richard has a master's in public health and public policy from Columbia University. He's worked as a healthcare consultant and served in the U.S. Peace Corps as a rural health volunteer in Paraguay. We're also grateful to have several subject matter experts with us from the CDPH immunization branch, and they'll be helping to answer maybe questions online or during the Q&A section of the webinar. So Dr. Liu would be our first speaker. Welcome. Thank you for being here.
Good afternoon. Thank you. In today's presentation, I'll review the epidemiology of hepatitis B and then briefly review the screening and immunization recommendations. And then at the very end, I'll go over some resources next. So first, hepatitis B is a vaccine-preventable liver infection caused by the hepatitis B virus and can be transmitted by percutaneous or mucosal contact with infectious blood or bodily fluids. Importantly, it can also be transmitted during delivery from the birthing parent to the infant, and that will be important as we talk about the epidemiology and also some of the prevention efforts. The acute hepatitis B is a short-term illness that can be mild or asymptomatic in many cases. An acute infection can lead to chronic infection. Young infants and young children have the greatest risk of developing chronic infection. So infants have a rate of up to 90% of developing chronic infection if they become acutely infected. So again, highlighting the importance of preventing young children from getting acute hepatitis B in the first place. And among people with chronic hepatitis B, there are many serious consequences that may occur. Up to 40% will develop liver cancer, cirrhosis, or other liver complications, and up to 15 to 25% will die from chronic hepatitis B-related causes. Unfortunately, there is no cure for hepatitis B, but appropriate care such as antiviral medications and cancer screening can prevent complications. So highlighting the importance of getting people screened so they do know if they have it or not. So first, we'll dive into acute hepatitis B epidemiology, In the US, the highest rates are among people 40 to 49 and 50 to 59 based on 2022 CDC data. And that's the graph I'm showing you on the right-hand side of the slide. In the dark green line and the light green line are the rates, and the dark green line are the rates for the people 40 to 49, and in the pink line are people 50 to 59. And those rates are highest among non-Hispanic white and non-Hispanic Black individuals, which looks very different from the epidemiology of chronic hepatitis B. In California, there are 62 cases that were reported in 2021, and multiple sex partners was the most commonly reported risk factor, although more than half of the participants, people who had tested positive, reported more than one risk factor during the exposure period. Also note that this likely is an undercount, as many people with hepatitis B may not even have symptoms. So let's move on to chronic hepatitis B. This is a major issue globally. Over 296 million people worldwide are estimated to be living with hepatitis B, and many of them are unfortunately not even aware that they have hepatitis B. In the US, this global epidemiology continues to affect us, as chronic hepatitis B disproportionately affects people born outside of the US. On the right-hand side of the slide, I show you a map showing you the countries most affected by hepatitis B. And in the darker brown colors are countries with higher hepatitis B prevalence. And you can see that large parts of Asia and parts of Africa have very high hepatitis B prevalence. And focusing on California, unfortunately, chronic hepatitis B disproportionately affects Asian Americans and Pacific Islanders. Looking at our data in California, Asian Americans and Pacific Islanders accounted for almost 2/3 of newly reported chronic hepatitis B cases. And for reference, AAPI are about 15% of the state population. And that's what we're seeing on this graph on the right, this disproportionate burden among AAPI. There are a number of different studies that have tried to estimate the burden of chronic hepatitis B in California, and one estimated that there are around 300,000 people living with chronic hepatitis B in California. So first we'll go on to CDC's screening guidance. I didn't show you on the prior slide, but many of those a large proportion of the people who are chronically infected don't know of their infection status. And so based on that and other information, CDC updated their hepatitis B screening guidance in 2023, which now is a universal adult screening recommendation with a triple panel that includes hepatitis B surface antigen, antibody to hepatitis B surface antigen, and total antibody to hepatitis B core antigen. In addition, the guidance also updated the screening recommendations for people who are pregnant to also screen people at least once with the triple panel. Previously, the guidance we'll talk about here on this slide recommended a risk-based strategy. And in California, there is a state law, AB 789, that requires hepatitis B and C screening based on U.S. Preventative Services Task Force guidance for adults who are receiving primary care services. And as a reminder of that USPSTF guidance, that is still a risk-based screening guidance for adults and adolescents with have risk for hepatitis B. And some of those risk factors we'll discuss in the following slides, but include place of birth and other kind of behavioral risk factors as well. So in terms of, we put together a little graphic summarizing what California law would like you to do. First, please screen for hepatitis B and C. If people screen negative, do recommend the hepatitis B vaccine. And if someone screens positive, then refer them for the appropriate follow-up care. We get this question quite a bit about screening and immunization. What order should we do this in? You can start the vaccine series at the screening visit, but do get that screening test done before you give someone a vaccine. So now we'll move on to the vaccine recommendations. The adult vaccine recommendations have been updated recently in 2022 and is now a universal recommendation for all adults 19 to 59 years. For people 60 years and over, it continues to be a risk-based recommendation. So some of those risk factors are shown on the slide, including people with liver disease, people living with HIV, who use injection drugs, with risk for exposure to infected blood, like people who are on dialysis, people who have sexual exposure risk, or people who are incarcerated. And anyone 60 years and over who doesn't meet these risk-based recommendations may still receive hepatitis B vaccine based on CDC guidance. There are many different vaccine options available for adults. The two main categories of vaccine options are 2-dose vaccine options or 3-dose vaccine options. The 2-dose option is much more recently available, Hepatitis B. And one of the advantages is that it does trigger a stronger immune response, and it has a novel adjuvant that helps stimulate that immune response. And it's also only 2 doses, which helps with the series completion. And I think Richard will share a little bit more data on some of those challenges with series completion. In terms of the 3-dose series, we'll go back. There are 4 different kinds of vaccine options available. Engerix B and Recombavax HB are 2 vaccines that have been around for many decades. Prehevbrio is a more recently available 3-dose option. And Twinrix is a combination hepatitis A, hepatitis B vaccine. One of the challenges with the 3-dose vaccine is getting people to come back for those doses. And so really completing the 3 doses is critical for attaining protection against hepatitis B. So for those patients who aren't done yet, please do encourage them to come back for their doses. It remains a challenge for those multiple dose vaccine series. And I also wanted to highlight that we do have a job aid that summarizes those different vaccine options. And then I'll briefly review the pediatric hepatitis B vaccine recommendations. I think overall we're doing well with this. Hepatitis B vaccine is recommended for all children in the US. The first dose is recommended at birth, and a complete series, the series should be completed at 6 to 18 months, and most children will receive 3 to 4 doses of hepatitis B vaccine to complete their series. If the mother is hepatitis B surface antigen positive or surface antigen unknown, there are additional actions to prevent transmission of hepatitis B. This includes hepatitis B vaccine as routinely recommended, potentially hepatitis B immune globulin, and a follow-up testing. And there are additional supports for individuals who are hepatitis B antigen positive as they're giving birth to prevent transmission to infants. I won't go over the different pediatric vaccine options. There are many of them. There are many different combination vaccines that do contain hepatitis B antigen in them. And I have linked on the slide some of those options and suggested immunization schedules. So in summary, chronic hepatitis B is a significant public health issue in California and affects thousands of Californians. Unfortunately, many of them don't know that they have chronic hepatitis B, and screening is critically important to prevent serious outcomes. And also immunization is important to prevent hepatitis B infection. So just as a reminder, CDC now recommends universal adult hepatitis B vaccination and universal screening of adults 19 to 59 years for hepatitis B. And additional efforts are required to improve immunizations and screening rates. And with that, I'll hand it over to Richard for the next part of the presentation.
Thank you. Great. So thank you so much for that, Doctor. My name is Richard So. As you've heard, I run SF Hep B Free, and I'm really excited today to talk about perspectives from our model working in the community, a really grassroots way to fight hepatitis B. And today I'll be talking about a little bit our history, what work we do, the challenges, the successes, and then how we as immunizers and other healthcare professionals can make a difference, because often that's kind of hard to figure out as a group, but there is a lot we can do. So first, why does Hep B matter? You heard already many of the burdens, but this is kind of a sheet we often show to the community to really show why it is a big deal and why we should kind of be working on it. 1 in 12 adult Asian immigrant Asian American Pacific Islanders are chronically infected with hepatitis B. This is as opposed to about 1 in 1,000 of the general American populace, so a huge burden difference. So much so that the CDC has called out historically that it is one of the, if not the highest discrepancy or disparity that Asian American and Pacific Islanders face in terms of any chronic disease. 2 out of 3 people who have it don't know it, and that's because of a lack of standardized testing, and I'll get into that later. And then also that most people don't have symptoms. Somewhere around 90% of folks who have chronic hepatitis B that has not progressed to serious liver disease don't have any symptoms other than maybe some fatigue that is often mistaken for any other sorts of ailments as folks get older. Yet 1 in 4 will go on to develop some sort of serious liver disease or complication that often results in significant morbidity or mortality. And that's why we often call this disease a silent killer, because most people don't know until it becomes late stage liver cancer or liver disease, and sadly, that's often too late. So, who we are. It was an organization started in 2007 exactly to address the lack of awareness in the general public, but also among healthcare providers around the risk that Asian Pacific Islanders face towards hepatitis B. You may recognize the two folks at the top, that then Mayor Gavin Newsom and Assemblymember Fiona Ma. Fiona Ma is now the California State Treasurer, and she herself has chronic hepatitis B that she really discovered to take care of thanks to Dr. Samuel So at the Asian Liver Center, who was a founder of this organization. And now she serves as our honorary chairperson, telling her story, because at the time, and many of the providers here may know, she was told, oh, everything looks good, you're what was called a healthy carrier. And so Dr. So at the time said, yes, but you're still managing it and checking in on it. And she said, no, my physician said, like, don't worry about this disease. And this was in the 80s and early 90s. So you saw this disconnect between what should be done in terms of managing hepatitis B. So it was an education, screening, and linkage to care collaboration with health systems, both private and public, the Department of Public Health in San Francisco, and community partners. And so you can see we had billboards, t-shirts, and then an amazing news anchor who also had hepatitis B, who shared his story during prime time, which was fantastic. So the challenges and barriers, clearly the lack of awareness by public and providers. Unfortunately, there were some surveys done when the campaign started where they asked providers to read Hep B screenings correctly and asked whether they were testing those at risk, and many of those came back not looking fantastic. And so we have historically done a lot of CME to remind providers that they should be testing, especially in areas where Asian immigrant population is very high. There's a lack of quality data on any smaller scale. A lot of data on hepatitis B is not differentiated between acute and chronic Hep B, and many cities don't have really the resources to give us good, high quality data on that, which makes any work, whether that be work for grants or just with a healthcare system, hard to do. Obviously, there's linguistic and cultural barriers around reaching our target audience, whether that mean in Chinese or Vietnamese, and reaching them where they are. Does that mean we need to go to ethnic media, radio, TV? Where are folks getting their information? A huge amount of stigma. This is something that I learned when I started, and many of you may or may not know that in many Asian countries, their hepatitis B is treated almost like how HIV was treated. People getting fired from work, discriminated against, marriages or romantic relationships called off, and then family members isolated because of misconceptions and misinformation, people thinking that just by being near someone who has hepatitis B that they can be infected. And then how do we reach large numbers of our target population? How do we actually create behavior change when folks look at themselves and say, but I seem perfectly fine, I don't feel sick at all, I don't need to do anything? In some minority populations, there's a mistrust in the healthcare system. We discovered this significantly in the Pacific Islander community, and so we deal with that. There's the lack of urgency, and of course, very little funding that goes towards hepatitis B. So best practices we've learned in our time. So we really need to understand our audience. And as all of you walk away from this, we really, really encourage you to reach out to us and look at your materials, whether you're from public health departments or you're trying to raise immunization how do we get those people in the doors through their own insurance and physicians, but also at things that could be like public settings. So the locale is important for us in San Francisco. That means going to Chinatown and various other areas that have distinct Asian populations that we know they're going to gather at. And then, of course, where are we reaching them, which I discussed a little bit before. And then it's really about leveraging community stakeholders. On the public side, we often know there's not enough funding for public health initiatives, but that means being crafty on how we look. So if you look at the top left, that's a collaboration with a community organization called Self-Help for the Elderly that specifically provides resources for older, mostly immigrant Asians, and is tackling things like loneliness, mental health, low income. So they provide meals, but they also provide a bunch of lessons, everything from how to not be scammed, which is a problem among many older populations, to health lessons. And so we went there, and there's a captive audience who is working with a trusted community partner, and therefore you're not just some random health department going into the community expecting people to listen to you. We have folks that they know, the leaders of this organization made a huge speech saying this is really important, you should all be doing this, and the conversion to actual screening and probably immunization is much higher when you do that. Same thing, getting Asian elected officials, other nonprofits that serve that community, and then ethnic media. The bottom left, for those of you in the Bay Area, KTSF is the primary Chinese language TV channel, and so we did a in-language appearance on one of their mainly watched TV programs with a physician and a patient asking and answering questions. The bottom right you'll see is us giving a presentation to a dim sum Cantonese banquet employee gathering, and we worked with that restaurant and said, hey, we're going to come and give this free presentation at a time that works for you. And so there's lots of ways to work both bottom up and top down. So we're out in the community, but also in ethnic media, also working with elected officials and health systems. And that way your single investment goes a lot farther. And so we really encourage you to work with nonprofits that are serving the community in a win-win capacity. I wanted to show a little bit more of what our work looks like. The top left is a newspaper ad in a Chinese newspaper. We did have a business initiative where we went business to business to put up flyers, so you can see that grocery store there. The middle photo is declaring May Hepatitis Awareness Month. This last year, we were able to get 3 counties to do a joint kind of activity. So this is in front of San Francisco City Hall, but San Mateo County, Santa Clara County, and San Francisco County made the declaration, and we brought actually believe the chief medical officer of the California DPH, Thomas Aragon, to speak at that as well. You'll see on the far left is a Pacific Islander church activity where we did an education as well. And then we even did some investments in social media style mobile ads, which greatly increased traffic to our website. And with recordable amount of hits, it was a little bit more pricey, but I think for the price, I think it was $20,000 for 2 months, something like that. But what drove folks to our site, and we also did this in multiple languages. And so what does that mean in terms of what exactly we did in terms of policy? Dr. Liu talked about AB 789. We were a main driver for that. We had joined a coalition to request funding for adult hepatitis B, the first ever funding from the state, from the California legislature, and that was $8 million over 3 years. And so that was an amazing initiative. We joined a coalition that already worked on several diseases that had a proven track record on getting funding for Hep C as well as other STI and addiction initiatives, and we got that funding in just 1 year of an ask. We did doctor or physician education. We're working on a current project we're calling the Blueprint Project that pulls in major healthcare systems to push for universal Hep B screening, and we already know that Stanford University is already doing that. We are part of a series of national and regional coalitions, including CalHep and the epidemics and the National Task Force on Hepatitis B. And so you'll see in the bottom left picture, that is from an old CME we did for, I believe, Kaiser Docs, and then some proclamations and some other media work. So achievements and ongoing challenges. We've screened over our history almost 30,000 people and directly educated way more, well, around 30,000 people, and we mean directly educated by one-on-one conversations or speaking like on a microphone to a gathered set of people. In terms of indirect education, that's our TV, radio, podcast, billboard ads. It's many, many more. We've done many state, county, and city declarations, innovative grassroots projects. We've done some particularly targeted stuff at Pacific Islander and for Filipino communities. And then also legislative and budget. Some of our biggest problems is we still have a hard time getting health systems to change, pushing towards universal screening, and we always have a lack of data, which is unfortunate. This is the small sheet that Dr. Leo was referencing, studies from the 2000s to 2020s, usually using data from that period or late 90s, indicate low completion rates of the Hep B vaccine, even though now, as was said, it's pretty much standard for adolescents and infants, and now recommended for adults, and that completion rate is somewhere between 22 to 54%. And this is across diverse populations, including some literature for high-risk adults, such as homeless and high-risk behaviors, but also regular claims data from commercial, Medicare, and Medicaid. Some of those studies show lower completion rates associated with higher risk factors, such as the age being lower, or males, Black or Hispanic, or lower income levels, as well as increased comorbidities. But quite frankly, as someone who has been told, well, everyone does adult vaccination pretty well now, the completion rates for such recent papers is pretty surprisingly low. So we still have plenty of work to do, and it's nice that the 2-dose vaccine is available because it does increase completion rates. But still, surprisingly, if I remember correctly, some of that is as low as 60%, even though it's only for the first day and 30th day, instead of the first day, the 30th day, and the 6-month mark. So this was gone over already, but really it's quite simple. We just need to get out there and get people screened and vaccinated, especially with the new CDC recommendations coming out. This should be a no-brainer. We just need to get health systems and, of course, health insurance to cover it all. The California law, doctors are supposed to offer Hep B and Hep C screening. Now, unfortunately, that's not universal. It's risk-based, as was discussed, but we're hoping kind of just to push because the CDC recommends universal adult screening. So how can you all get involved in all of this? There is a lot you can do, even if you're just public health and you're not a practitioner in terms of a physician or nurse. Work with us, work with your system, local systems, to see how to improve hepatitis B education and screening and vaccination. We believe that telling patients that the CDC recommends it for everyone and knocking out Hep B and Hep C has been a boon for us in the community. I can tell you, when we say that, people are like, oh, cool, I should just get tested for both. Sounds good. Just do it. Preliminary results out of the Stanford paper, it was actually both their qualitative and quantitative paper. Their quantitative paper, I think, was submitted today, show that the universal screening significantly increased screening and caught a significant amount more of undiagnosed hepatitis B. And there, on the provider side, there was neither resistance by providers who actually said, great, I don't have to remember the risk-based stuff. I can just tell everybody to do it. So that makes it even better for me. And also, we were afraid that some patients would say, hey, why are you testing me for this disease that's somewhat associated as an STD? Because we had some experience with that in the past. And most of Stanford's patients said, great, this is something I was supposed to get, and didn't have any qualms about that either. People compare it, if you are a vaccinator or from the pharmacy, people compare it with other vaccines. That's the fall, COVID vaccine, RSV, and flu vaccines are all something that you can say, hey, just get everything you need, especially because the vaccination is almost always covered under insurance. And then collaborate again with folks like us, pharmacy staff, community education. We're doing an interesting project with Walgreens as they try to promote Hep B vaccination, where they're letting us do tabling education in front of their stores, and sometimes in their stores right near their pharmacy, so that people are stuck, waiting in line for their prescriptions to fill, or waiting in line to get their new COVID vaccine. I just talk to them and tell them about Hep B. And we're seeing some preliminary results that seem to indicate that more folks are getting the Hep B vaccine at the same time around we've come in. Of course, we can't connect them to directly, but that is really, really exciting. And then historically, we worked with health systems and retail pharmacies that allowed us to put a little note card that said, hey, have you considered getting your Hep B vaccine? And we haven't been able to do that more recently, but it was a great idea and something we were able to execute on. So I know I went through a lot of things very quickly, but I would love to take any questions and provide the answers.
Thank you so much, Richard, Dr. Liu. So thank you all for our speakers. And if you've been waiting to ask questions, now's the time. So we've received a couple questions during our registration and while our speakers were presenting. So please add your question in the section at the bottom of the screen. So one of the first questions, how can we work to promote access via pharmacy? This pharmacist partner of ours anxious to find a way to increase that Hep B education. Any other thoughts? I know you mentioned your partnership with Walgreens. Brilliant idea, of course. I know our pharmacy partners do amazing work, but it's a lot going on in the pharmacies nowadays. So any other thoughts on how they can work with you?
Yeah, this is Richard. I can jump in here. So I think for us, what has always worked is you find someone that will inevitably or accidentally become a champion, and just talking about the win-wins for systems in which giving vaccines is also revenue generating. And forgive me, I don't know if that is also the same for academic pharmacies. But for Walgreens, we said, hey, this is a deep need. It's not controversial at all. It's, you're going to save lives and you're going to generate revenue. And they were like, sounds good. Like, it was as simple as that. And then it's just small, like trying to move the needle in ways that won't burden your pharmacy at all. And so with Walgreens, it was as simple as, can we put a poster up that is, at least somewhat well designed? You ask a couple of patients or just community members, would this get you to read it and maybe get vaccinated? Another really interesting small thing was, can we speak to your pharmacy staff and can we get them to just say, by the way, Hep B vaccine is available, covered under your insurance,
Mhm.
and you should get it. Now, Walgreens has some, and I think this may be applicable across, they said only actual trained pharmacists can talk about what is they should get. And so we were limited in that sense, but we said, okay, can the pharmacist, if they're talking to the patient, directly do that? And can we put a sign right next to the window where, the plexiglass where they hand them out? And so they can be, so that the tech can say, oh, like, we have a list here of vaccines that you could get, and that would usually include, flu, COVID, any of the other ones, Mpox type stuff going on, and Hep B would be there, and then you might prompt that question, oh, what's this Hep B thing? In which case, a tech could answer that. And so
Mhm.
and then the final thing is this may take extra little bits of work, but that's where an organization like us could come in and say, let us do the thinking and do this, then propose the easiest answer, and then you get that one person who you told the data to be like, yes, let's try this even as a pilotable thing. So that's what I would say, and then we can at least try.
Yeah, thank you. Very good. Very good question answers. And some questions about outreach to immigrants, the immigrant community,
Ooh.
and specifically also it was slash homeless, but I think those are two very separate outreach opportunities.
Yeah, Dr. Liu, did you want to take a stab from the CDPH perspective, or do you want me to jump in from our perspective first?
Go ahead and share what your perspective.
Yeah, for the homeless and immigration populations, homeless is always really hard because their adherence, as well as whether they'll show up to an appointment, is really difficult. In terms of hepatitis B, we don't see it as much statistically in that population as opposed to something like hepatitis C. But programs that we work with in San Francisco find a lot more success when they have something like mobile clinics or reach out teams. We know that type of support can be quite expensive and like time consuming. Um, and so that's really hard for us. We just kind of add, since that's kind of not our largest population of at risk for Hep B, we kind of jump on to Hep C's work and say,
Mm.
make sure you test for Hep B because obviously there's compounding liver damage issues there. In terms of the immigration policy or low income, like housing at risk population, we really depend on our other partners that work with those populations. So we're not reinventing the wheel. I think one of the things that is the most important is if you guys are part of public health departments or major institutions, go to quote the experts, which are all of the organizations that are working on the ground. And that's where you're already going to have that captive audience, that trusted partner. And then they likely can adjust some of the materials they have to work with you, so your monetary and time investment is much lower. And so you really got to go to where those populations are. That's the best I would say for reaching those two types of folks.
Terrific. One of the questions that came up, and I'm really glad it did because I was going to bring it up if somebody didn't, was around talking with parents
Mm.
pre for Dr. Liu or Richard, talking to parents before the baby's delivered, after the baby's delivered, maybe if they delayed their hepatitis B vaccination. Can you give us a couple tips on that? How you communicate, how you manage those conversations in the community?
Yeah, so sorry, is the person asking whether, like, because the conversation around hepatitis B, like, whether those parents are having the baby or the next
Oh yeah,
generation?
that's true. I'm sorry. I'm talking about vaccinating the parent. I'm sorry, vaccinating the babies for hepatitis B, concerns that they have about that, which I understand what you're thinking. Maybe we should state on that one because, right, parent, you have conversations with parents
Yeah,
before.
so
Maybe let's go there first and talk about
yeah,
that those risk factors that
yeah.
impact parents prenatally.
Yeah, so from what we have heard now, and prenatal Hep B programs might be better suited to answer this. So if someone is attending, is we don't get much resistance in these days of new parents not wanting their kid to have the Hep B vaccine.
Mhm.
Now that it's become a standard infant vaccine, we don't really see that in our Asian parents who are now tend to be second or third generation seem to be pretty pro. Let's give everything that our kids want. Outside of some, I'm sure people have heard the news of some certain like upper end, very wealthy communities that have some issues with vaccines. Um, on the other hand, something that we did run into a lot is uh, parents, first generation folks being very hesitant to talk about Hep B in general. Um, we know
Mhm.
that a lot of the perinatal programs in San Francisco that are for new immigrant mothers, they always have oh my God, like, Miss Mom, you have this, you should really tell your family and get your husband in here, get your family in here to get tested.
Mhm.
And they go, yeah, 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 that sounds great. And then very rarely does the family come in and do that. And then when the patients ask and such, or when the physicians ask, they're like, I don't feel comfortable telling my husband, or I just don't want to deal with that in my community. So I'm sorry, but I get it. I'll try to find some way to get my family tested. And so there's a lot of stigma in that new immigrant community, and
Mhm.
that still is it really exists. The best way that folks have done is that we hear from our providers is just trying their best to educate the most and get rid of the misconceptions and stigmas and really say, hey, this could save your life. One of the best ads that's done by the CDC, and you can find this still on YouTube, is based around this: I want to be there for my kid. So
Yeah.
let's forget like that it's your health or you don't feel sick. Do you want to be there for your kid, when they get married and such? Then that starts with your own health. So get this done so you don't essentially die prematurely. And that's a messaging that has been a little more effective. I hope that answers the question.
Yeah. Yeah. Added to it a lot. Dr. Liu, do you want to add anything
CDC
else?
has a lot of really helpful information around the importance of infant vaccination and birth dose vaccination, so we can certainly share those resources afterwards. There's a CDC also funds a perinatal hepatitis B prevention program that is run through local health departments. We do have the person who runs our program here. I don't know, Rosie, if you want to make any other comments around some of those challenges and working with Hep B positive birthing parents.
Yeah, I mean, I will just echo what Richard said about there is still a lot of stigma in some communities. Um, it's something that we kind of are trying to figure out new ways to address either through written materials or just oral communication with some of our local health department staff. Um, but I will also add, in addition to what Dr. Liu said about CDC's resources, immunize.org is also a great resource.
Mhm.
They have a lot of materials both for providers and facilities who might be administering the birth dose vaccine, and also some FAQs for parents about why their child or why their infant needs a vaccine that quickly. So I just wanted to make a plug for them as well.
Yeah. Thank you so much, Rosie, and thank you for being here. Staying on the theme of new babies, I've got a question from, and I'll read most of this here. I'm a new perinatal Hep B coordinator, and she finds very little pushback for infant vaccination, but does have issues with getting post-vaccination serological testing. So any comment or questions or tips you can give this newer coordinator?
Yeah, I mean, that's a common something we see often. I think a lot of times parents don't necessarily understand why their child needs to be tested.
Mhm.
Oftentimes they may not want to take, their 9-month, 12-month-old infant to get a blood draw, which I understand. Um, and so we really just try to work with pediatricians to communicate the importance of this testing and to also just try to pair it with other testing or other things that are happening at those well child visits.
Mhm.
So the 12-month visit in particular is one where blood is being drawn for other things, and there's kind of there's a way to try to wiggle that in there. But that is a common experience that our local health departments encounter. And so
Perfect.
if someone has particular or specific questions about cases they're working on or patients they're following, they're welcome to shoot me an email and we can talk more offline as well.
Yeah, thank you. That those folks can send us an chat in here with their email, and we'll connect you all. So yeah, so we got some resources, we got some more educational materials. Cameron's been throwing some great resources into the chat there. Happy to connect people with that. Let's see. One of the questions also, what is the maximum interval between dose 1 and dose 2 for I guess the 2-dose Heplisav?
In general, there's no maximum interval. So if someone is
Right.
coming back for their second dose, just give it to them. I think the comment I will make there, I think the earlier question around people who are experiencing homelessness or who are immigrants and who may not come back, we always say don't miss an opportunity to vaccinate. So if someone is here and you're not sure they're going to come back, it's okay to give them that first dose, and then you make your effort to schedule that second dose, make efforts to make sure they come back. But if they don't, we hope that they'll have an opportunity in the future to get that second dose to be fully protected, or the third dose.
Yeah, I remember in my health department days, that question would come up a lot from not just this vaccine. I mean, not that just the Hepatitis, but if I'm pronouncing that right, but just about people who started their hepatitis B series but did not complete it, and were told or were under the impression that they had to restart their series. And I'm not sure if that comes up much still, Dr. Leah or Richard. Whether people understand that if they had their hepatitis B, they only got one for whatever reason, maybe when they were 18 and never went back to it.
On our end, it's almost the one question that's asked every time.
Oh, is that
I
right?
think I got this, and do I
Right.
need more? And so we always say, when in doubt, you can get a booster.
Right,
It's
right,
not going to do anything bad, especially since it's covered under most insurances, so there's no fear. We
right.
tend to say that getting, as long as you've finished the vaccine series, that it protects for life. But then feel like if you've gotten a test and it doesn't show the titers like that, you have the immunity. Follow what your physician says. Um, I think for us, it's a balance between us saying it does protect for life, which mostly does, and that sounding like a great thing to do, like I don't have to do it every year, and then saying, but your doctor knows best. So that's generally what we say.
Great, great. Any other additions? Great. A question about pertaining, I think you were going to answer that one on that I was just about to ask, Richard, pertaining to AB 789 requiring screening. This attendee asked, how are the costs paid for? What are the options for uninsured adults?
Yeah, so the good question. So the law has no budget tied to it,
Of
and it's
course.
for primary care physician. Otherwise, we definitely wouldn't have been able to pass it. Has no, it is for primary care physicians, and so I don't know the actual details for it. What we always do is send anyone who wants to get screened to one of our community allies who do one of two things. They either have a sliding scale fee as an FQHC, a federally qualified health center, or they sign up people for Medicaid, and once that process starts going, they're able to do it. Fortunately, our FQHC local one that deals mostly with Asian immigrants is running a program. This is Northeast Medical Services that is offering free hepatitis B, actually Hep B, Hep C, and TB tests from a grant from Quest. And so that was really amazing. What I would say is if you do have, like, for any public health folks on the call, like, have one or two resources in your pocket, whether that be the one, some folks have an amazing, like, totally charity care clinic in their area, but many will have either your local county clinic or an FQHC, and just be ready to say, hey, you should go there and do the best you can, and then of course have a champion at that clinic that knows that you're referring folks to them.
Great, great. Thank you. One of the earliest questions, we have about one or two questions left that I'm going to take. One of the earliest questions we had about whether you know what level of success any other countries have had with decreasing their HB surface antigen and endemicity level. And meaning, how does how does the United States rank in terms of reducing our incidences of hepatitis B? Are there any other countries that are doing, I think that what they're asking is, are there other countries that are doing really strong work that we can learn from?
Dr. Leah, do you know any of this?
I'm not the expert in this, but I will say that the Asian Liver Center has some really helpful data on their website showing you immunization I was reviewing this some time ago, but really helpful profiles of different countries. And
Okay.
I thought it was just a really helpful summary of where things are. For example, if you look at China, there's been really successful immunization programs that have been implemented there. So would direct you to look at that to kind of see where things are globally.
Yeah, it's a great question, and something important for us to keep an eye out for, because this is where it's something that is we can eradicate, we can get a handle on better, but we have to work together, and we have to use that power of those not just state connections and national connections, but international connections to see what we can do to destigmatize. That just really feels like such a powerful tool, is to help people understand how to talk about it with each other, to not be as judgmental and rough on people who end up being positive. I'm going to wrap this up now with a couple announcements, but I wanted to see if there were some final thoughts from each of our speakers.
Yeah, well, I apologize.
Yes,
Can
go
I just
ahead.
knock out two answers like in like
Yes,
2 minutes?
absolutely. Absolutely.
Okay, so presentations focused on screening and vaccination, but not preventing getting Hep B
Oh,
in
yeah,
the first
yes,
place.
yes.
So that one's really quick. We don't end up doing that much because chronic Hep B is mostly transmitted in the Asian immigrant community from mother to child transmission. And since the mid 90s, testing pregnant mothers has become standard. And so that cycle of transmission has mostly stopped. So we generally end up talking about, hey, get tested so you know. We, of course, talk about the STD version of it, but because it almost always results in acute hepatitis B, which is self-resolving, I always just say, just get vaccinated so that even if you were to come into contact,
Right.
like you'll be fine. And then the first question from Timothy Peters, I think is really important, and folks here could make a big difference. Yes, on the Quest form or the LabCorp form, it can be really confusing, or even in labs from academic centers. And really, for us, we've been told that's kind of all on you all to say, hey, this is confusing. Can you fix this for our system? And again, we would be happy if you reached out to say, like, hey, I think my system one is confusing. Can you serve as a community advocate to change this? But we hear this all the time from physicians who are like ordering the wrong thing. And so we would say, like, let's go to Quest, let's go to the lab and say, put all of them in a little box that says CDC recommended. So they check those 3 tests and be done with it. But we, as a random small nonprofit, have no sway. They're going to need to hear from their customers and their providers on that.
Yeah. Right. Yeah, and I don't think our whole audience can see that question. I don't think so. The question was, how can commercial lab menus be improved to improve confusion regarding hepatitis B lab screening? And so you offered a wonderful suggestion. Thank you very much.
And maybe I'll just
Yes,
make one
great
last
question.
comment. I know
Yes.
Richard talked about successful funding that his group was able to help advocate for, and that funding is going towards supporting demonstration projects that are looking for best practices to improve screening, vaccination, retention, linkage to care, all of these important topics related to hepatitis B. So we hope in the coming months that those projects will be ready to share some of the findings. And I think we have more to talk about with kind of best practices and things that can be done to address some of those challenges.
Wonderful. Thank you. Thank you so much. We're wrapping up now. I want to thank Richard So and Dr. Katerina Liu and Rosie from the CDPH team for sharing their expertise and experiences with us. And we also want to thank the CIC Education Committee for support and planning and coordinating this call. Next slide. I want to remind you about our evaluation, which I mentioned earlier, our YouTube channel, which you can subscribe to find this program. And if you have any questions following, we'll work. I always say we'll do this. Sometimes it takes a little while to get some of the links on there and other information that'll help you with your work in promoting hepatitis B awareness. So links to this webinar are all on there. Next slide. Wanted to let you know that we will be sending out our save the date for the annual CIC Summit, April 29th and 30th in Riverside, California. We'll have our calls for abstracts, leadership award nomination, and again, our registration page coming soon. Next. And our next education hour will be announced via our monthly CIC newsletter, the Vaccine Booster. And you can find that information. We share all of the upcoming education hours. Other activities are happening throughout California and nationally as people want to learn more about that. Please let us know if you're not already receiving that. Next slide, last slide. So thank you so much for your participation and your support. Go get vaccinated against everything, but especially hepatitis B if you haven't already. And all of our annual COVID and flu vaccinations. Really, thank you so much for all your work, and we will see you soon. Have a great day.